Hello, everyone. Hello and welcome to the S&P Senior Medicare Patrol podcast, Sip and Learn with S&P. Thank you for joining us today. I am Johnetta with Senior Medicare Patrol. I am the Community Outreach Specialist for the Mississippi area. We also cover the state of Georgia. So today, our topic for today, we're going to talk about medical identity theft. We will tell you the difference between medical identity theft and regular just identity theft. And we'll talk a little bit about how we can prevent this with our fraud tips at the end.
And I'm Brenda, the Community Outreach Specialist for Louisiana. Before we get started, I must say that this project is supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services, Washington, D.C. 20201, and that S&P is sponsored by AdviseWell, Inc. So today, we're going to get started on our podcast, Sip and Learn with S&P, and I am going to be asking Johnetta, what is identity theft? And what is medical identity theft? What's the difference?
Okay. Well, the Federal Trade Commission's definition of identity theft is when your personal information is stolen and used without your knowledge to commit fraud and other crimes.
Okay.
Medical identity theft is when someone obtains your personal healthcare information, and that would be like your Medicare card or your Social Security card. And they use that to access your benefits. And that also includes like a prescription drug card, or if you had a dental card, any type of medical identification.
Okay.
It also occurs when criminals use your medical information fraudulently to bill insurance providers or government programs for medical goods and services. And these services that are not provided. So they'll try to use it for services that are not provided.
Okay.
Okay. So that is the definition of identity theft and medical identity theft. So Brenda, tell us, what can we do to detect medical identity theft?
Well, the first step to detecting medical identity theft is to read your medical and insurance statements. We all get those once we've used our insurance for whatever reason. You need to read these regularly and completely because these statements will show warning signs of identity theft. When you are reading your Medicare summary notices, which are also called MSNs, or your explanation of benefits, which are also called EOBs, here are some of the following items that you need to be looking out for, okay?
Okay.
So you need to look out for the name of the provider. Make sure that they are correct and that you know the doctors that are being identified on those statements. Also, dates of services. Make sure the dates match the dates that you went to the doctor or had some kind of service provided. The particular service provided, make sure that you did indeed get that blood test done or that X-ray or MRI or whatever it is that is showing up on your statement. Make sure that belongs to you. Other signs of medical identity theft include a bill for medical services that you did not receive. Okay, so if you're being billed for something that you know you didn't get, that could be a sign that your number, your insurance card or your Medicare number has been compromised.
Okay.
Also, a call from a debt collector about a medical bill that you do not owe. Okay. Don't let those calls intimidate you. Ask questions and make sure that it's something legitimate. Also, medical collection notices on your credit report that you don't recognize. You know that everyone has access to a free credit report every year. Make sure you do that. Check your credit report and that you are familiar with everything that's on it.
Okay.
Also, a notice from your health plan saying that you have reached all your benefit limits. If you know that that's something that doesn't sound right to you, look into it. Do not feel afraid to ask questions. You have a right to all of this, to find out what's going on with your insurance information, your health insurance information. And S&P is here to help you if you need that. So that kind of help. So those are some examples of how you can detect medical identity theft that may be pertaining to you. Okay.
Okay.
Okay. So Johnetta, how can you protect yourself from all of this medical identity theft? What are some tips?
Okay. Well, the first thing we suggest is to read your Medicare summary notice or the explanation of benefits. Take the time out to look over that information, and that's where you're going to find any discrepancies.
Mhm.
The next thing we tell our beneficiaries to do is to shred all the medical related documents before discarding it. And sometimes in your community, they may offer a shred day for the citizens in that area, or at your
Mhm.
church, local civic organizations and groups that have a shred day, and you can bring all your documents over and you can have them shredded. And that's if you don't have your own shred machine. But you can check into that into your local area. There's usually some type of shred day going on throughout the year in your area. The next thing we ask is to keep accurate records of all your doctor's appointments and your medical procedures. And you're going to do that with your calendar or your healthcare tracker or your journal, but you want to keep track of any appointments. And we want you to protect your social security number and your Medicare number. Do
Mhm.
not give out that information to anyone, especially people that you don't know. Don't give it out to any strangers. Okay, Brenda. So where is a reliable resource to report medical identity theft? Where can a person go, an individual go, if they want to report something?
Well, if you need to report anything, you can call us, Senior Medicare Patrol. We're a very reliable resource and we're a free resource to you. If you suspect an error on your MSN, which is a medical summary notice, or your EOB, explanation of benefits, you can contact your health provider first. If they are unable to resolve your issue, then you can contact us, SMP, free at 877-272-8720. Our hotline is available Monday through Friday from 8:30 in the morning to 5 in the afternoon Central Time. And if you need to call us after business hours, you can always leave a message and someone will reach out to you the next business day. If you need to reach out on the weekend, also leave a message. Again, they will reach out the next business day. You can also go to our website, check that out at stopmedicarefraud.org. You can also go to our social media platforms. We're on Facebook under Senior Medicare Patrol for Louisiana, Mississippi, and Georgia. And we also have a Spanish Facebook page in case you know someone that needs resources in that language. If you're listening to this podcast and you just happen to not live in Louisiana, Mississippi, or Georgia, don't worry. There is an SMP in your state, and you can contact the SMP National Resource Center at 877-808-2468 to ask for the number, to your local SMP, and they will connect you to them. Or they can also go to the website as smpresource.org, and they will connect you through the National SMP hotline to your state's SMP program. So those are just some of the things that you can do to reach out to a reliable resource, which happens to be us, Senior Medicare Patrol, to report any type of medical identity theft. And really, you can just call if you have any questions regarding this. It doesn't necessarily have to be something that you caught on your EOB or MSN. If you just have a general question, we're here to help you. And if we can't help you, we can surely guide you to the correct resource so that you get the help that you need. Okay.
Absolutely. Yeah. That's great information.
So yeah, it's very important that people know that someone's here for them. And, you may not realize that this really happens more than we wish, it didn't happen. It's
Right.
always going on. And that's our main mission, to help you figure out what happened so that you can get that peace of mind back, that, everything's going to be okay when it comes to your healthcare information.
Okay.
So Johnetta, what are the 3 key prevention tips?
The 3 Medicare fraud prevention tips are protect, detect, and report. The first one is protect. We always tell our beneficiaries to protect your Medicare card and your Medicare number. Treat it like your debit card or your credit card. Do not give out that information.
Okay.
The second one is to detect. Keep track of your doctor, clinic, or the hospital visits, and you want to compare them to the MSN or the EOB. These are your Medicare statements, the MSN and the EOB, and you want to keep track of that information in something or on a calendar so that you can refer back to it in the future if you have to. The third one is to report. If you detect something on your Medicare statement that is not correct, report it. And you can do that by calling our toll-free number is 877-272-8720. As Brenda said, Monday through Friday, 8:30 to 5 Central Time. Again, that number is 877-272-8720. So Brenda, tell us a little bit about how can you get involved? If you have questions or if you want to get involved with something in your community, tell us about volunteering for our program.
The volunteering aspect of the Senior Medicare Patrol program is very popular. People are always looking for something to do and to give back to the community. And we have that opportunity if you're interested. We're calling them the community fraud fighters now. So if you want to be one of them, you can reach out to us at 877-272-8720 and ask for volunteer information. And you will be able to make a difference in your community by joining us or joining your particular SMP in your state. And then you would become a volunteer for the Senior Medicare Patrol program or a community fraud fighter. Whether it's giving a presentation or staffing a booth at a community event that benefits, the benefits are rewarding, not just to the community, but also to you. If you're interested in joining, again, it's a process that you have to go through, but it's not a very complicated process. You can call us at 877-272-8720, and you can just request your volunteer packet, and we will just guide you through it. We have a lot of retired teachers that are volunteers, also people that work in law enforcement, and even in the health care field. They have retired, but now have come on board as volunteers with the SMP program or community fraud fighters because they still have that, enthusiasm to go out in the community and give back in some way. And so they volunteer for the program and they have really, really enjoyed it. And we have volunteers that have been with us for a long time and just continue to help us out. As community outreach specialists, we need all the help that we can get.
Absolutely.
And these volunteers help us, and not just by giving out presentations, they also do other things for us. For example, stuffing bags and putting together brochures and different packets and making copies for us.
Yeah.
So there is something for you to do at SMP if you are interested. So give us a call, 877-272-8720. We'd love to have you. And we would appreciate that. Yeah, definitely.
We'd love to have you as a volunteer on our team. So if you're interested, don't hesitate. Just call that number and get that packet and get started. We'll walk you through it.
And also today, for listening to us here on Sip and Learn at SMP, for listening to Johnetta and I talk about medical identity theft, if you call us at that same phone number, 877-272-8720, you will get a free My Healthcare Tracker with our message there, protect, detect, report. Those are the keys that Johnetta was just talking about. And this will keep you it'll accompany you to all your medical visits, and you can take notes and write down dates and medical providers' names so that when you do get those statements that we were talking about, you can compare and make sure that all of that information is correct. And if you see something that isn't and you want to question it, our phone number is on, I think, every page in this book. So you can call us and we will see how we can help. Remember, we are a free resource to you.
Okay. Okay. Well, thank you, Brenda. Okay. That was an overview of medical identity theft. and how to protect yourself. So thank you for joining us today. Thank you for tuning in to this episode.
And we hope you join us again for our next podcast. We have a series of them already. There's something for everybody. Our series is called Sip and Learn with S&P. And for more S&P content and information on new topics, remember to visit our website, www.stopmedicarefraud.org. Johnetta, until next time.
Thank you, Brenda. Bye-bye. Stay safe, everybody.
Stay safe.